Good evening, everyone, and welcome again to another Sunday. We're doing a Fibroid Awareness Month, as July is actually National Fibroid Awareness Month, where we're going to just be discussing uterine fibroids. And we're going to teach about non surgical options. Just let me know in the chat. I'm coming from Central Florida, coming to you from Central Florida. Let me know in the chat where you're tuning in from. We're going to get started immediately. Congratulations to Spain for winning the World Cup, and they played really well. That was a very exciting game. So we're going to get started. We're going to teach on uterine fibroids, understanding fibroids with non-surgical options, everything your doctor should have told you about UFE. So this statistic, only 3.5% of women with fibroids actually receive a non-surgical options, which is a urine fibroid embolization. So where did the 96.5% go? Well, 73% of women receive a hysterectomy, that's their uterus is completely removed. 23% have a myomectomy, which is also major surgery. And only 3.5% are offered a 45-minute outpatient procedure. Well, tonight that changes for everyone in this room. So I'll say a 45-minute roadmap of what you're going to learn tonight, what uterine fibroids actually are, and why they're so common. 7 symptoms most women ignore or blame something else. We're going to go through all the treatment options, honest pros and cons, a deep dive on uterine fibroid embolization. We'll talk about what insurance covers it and getting evaluated, and we'll do a live Q&A where I'm going to be here to answer all your questions. So is this webinar for you? Well, these are the typical signs. And I want you to look through all these signs. If you have 3 or more, then you know that you may have uterine fibroids. So number 1, your periods are so heavy, you go through a pad or tampon every hour. You have painful sex or periods lasting longer than 7 days. You have pelvic pressure, heaviness or fullness in your lower belly. You frequent the bathroom, go to the bathroom a lot because your fibroid is pressing on your bladder. You have a bloated belly that looks like pregnancy but isn't. You have unexplained back or leg pain or constant fatigue from monthly blood loss, and you've been told surgery is the only option. I'm Dr. Obid Anwobi. I'm a founder of Vein Health Clinics. We have 5 locations across Central Florida. After my MD in Tennessee, I did my general surgery training in New Jersey and vascular fellowship in Albany, New York. I also did a master's of public health at Johns Hopkins. I'm board certified in vascular surgery, and I'm an expert in minimally invasive disease. So what are fibroids? These are the basics every woman should know. Well, they're not cancer. That's the main thing. They're benign in almost 100% of the cases. Most common, you get it between 30 and 50, and after menopause, they usually shrink. They range from a seed to a grapefruit to a watermelon, so they can grow really big. And they grow in response to estrogen and progesterone. And they can cause no symptoms, but most of the times they cause very significant symptoms. So they're very common, but they're treatable and you have options. So how common are fibroids? Well, 70% of all women develop fibroids by age 50. Interestingly, 80% of Black women develop fibroids by age 50. And there are 26 million people who currently are living with fibroids. Most women are diagnosed late after years of symptoms are dismissed as normal periods. And fibroids, interestingly, are the number 1 reason for hysterectomy in the United States. So 62% of women have never heard of any minimally invasive option at all. And that ends tonight. So what are the types of fibroids? Where they could grow intramural, that's on the wall. This can cause very heavy periods, pelvic pain, bloating, and enlarged uterus. They could become submucosal. These cause the heaviest bleeding. They grow beneath the uterine lining. They cause, and they also can impact fertility as well when they are in the uterine lining because they prevent implantation. They could be subserosal. That means they can cause a lot of pressure symptoms. They grow outside on the outer of the uterine wall. They also can cause urinary frequency or back and pelvic pain. Another type is pedunculated, but uterine fibroid embolization is effective in all types of uterine fibroids, regardless of the location. Excuse me. So size matters. This is visualizing your fibroids. They can grow be a grape, lemon, an orange, grapefruit, and a cantaloupe. So they can grow really big. Excuse me. UFE can shrink fibroids by up to 83% in size, regardless of the starting size. Excuse me. These are 7 symptoms you might be ignoring. Number 1, your periods are so heavy, you go through the tampon every hour. You have pelvic fullness. You have to go to the bathroom a lot because the fibroid is present in your bladder. You have a bloated belly. You have painful sex lasting longer than 7 to 10 days, back or leg pain, or persistent pain or fatigue, sorry. So let's do a short video showing you a brief demonstration of fibroids.
Uterine artery embolization is a modern, minimally invasive treatment for uterine fibroids, especially when surgery is not recommended or when the patient wants to preserve the uterus. The procedure is indicated for symptomatic fibroids causing heavy menstrual bleeding, chronic pelvic pain, pressure on the bladder or bowel, or rapid uterine enlargement. Under local anesthesia, the femoral or radial artery is punctured and an introducer is placed. A diagnostic catheter is advanced through the introducer into the common iliac artery, and then into the internal iliac artery. Using digital subtraction angiography, a catheter is guided into the uterine artery. Embolization particles are slowly injected through the microcatheter. These particles occlude the lumens of small arterioles, inducing ischemia of the uterine fibroid while preserving blood flow to the myometrium. The catheters and introducer are then removed. Within 3 to 6 months, myomatous nodes decrease in volume by an average of 40 to 60%. Menstrual cycles normalize, while pain and the sensation of pressure subside.
So that's just an example. So let's talk about how fibroids affect your daily life. Well, they affect your work. Women with fibroid miss an average of 3 to 4 days of work per month due to symptoms, which is cost about $34 billion in annual US productivity loss. Family, pain during sex strains relationships, and fertility challenges create emotional burden. Mental health, chronic pain, fatigue, and it's usually being dismissed by doctors and leads to anxiety and depression, which occurs in 1 in 3 women that have severe fibroids. And women wait an average of 3.6 years from symptom to onset of diagnosis. They are told it's just a heavy period, try birth control, you feel better after menopause. But who wants to wait 10 to 15 years feeling bad? Importantly, and something that is very important for me, is that there's a racial health disparity. The data on fibroids and Black women is terrible. It's also actionable. 80% of Black women have fibroids by age 50, and 3 times more likely to have severe symptoms. And they are 2 times more likely to be offered a hysterectomy first. There's some important things like genetic factors, vitamin D deficiency. So you definitely should be taking some vitamin D supplementation, chronic physiological stress and inflammatory response with that, fewer vascular interventionalists in Black communities, and it's systemic bias and referral patterns. So they're not offered minimally invasive procedure. I want every woman in Central Florida, especially Black women, to know you have options, not just a hysterectomy. So how are fibroids diagnosed? Well, there are 4 tools that usually put together give us a precise diagnosis. The top two are the most important. A pelvic ultrasound, this is non-invasive. It identifies the fibroids and is usually done transvaginally for precision. The next and the gold standard is MRI scan. This is what we used to before UFE. If you're over 40, it shows the precise location, the vascularity, and also shows if you have other underlying things that could mimic fibroids as well. So take a breath. You're not alone, okay? A lot of women have fibroids. Pretty much four in every five women have fibroids. So if you do, don't think you're dealing with it alone. A lot of people have it. Your symptoms are real, heavy periods, pelvic pressure, fatigue. They're just not, it's not normal. They're treatable. And if you get an MRI, we can get this diagnosis and you have different treatment options. So let's talk about your treatment options. This is everything in a glance. You have the traditional treatment, which is a hysterectomy, which is surgery. It is a surgical removal of the uterus. It's permanent. You won't have any more periods, no more pregnancies. This is general anesthesia. Hospital stay is 2 to 3 days. Your recovery is about 6 to 8 weeks. The second, which is fertility preserving, is a myomectomy, where they try to pluck out the fibroids from the uterus. Most of the time, the fibroids can grow back within 2 years. You have general anesthesia for this, you're in hospital for 1 to 2 days, and recovery is about 4 to 6 weeks. And then the third option, which we're pushing for tonight, is the UFE, which is uterine fibroid embolization. It's minimally invasive. It's the blood supply to the fibroids are just decreased, and the fibroids shrink right on your uterus. Your uterus and fertility is preserved. It's done under local and moderate sedation. It's done same day you're home, and recovery is usually 3 to 5 days, but it could be up to a week. So let's go into the pros and cons. Hysterectomy. This is complete removal of uterus, but sometimes they take out your ovaries as well. It totally eliminates the fibroid, but also eliminates the uterus permanently. The pros is a permanent relief. Your fibroids are gone forever, and your uterus is also gone. It eliminates all fibroids definitively. There's no periods after surgery if you have a total hysterectomy. So it may be best when there's a concern for cancer. Cons are is major surgery. You have to take off work for at least a month plus, and you're in the hospital 2 to 3 days. There's a permanent infertility. There's no future pregnancies with this. And there's a risk of early menopause if they mistakenly remove your ovaries. There's also a risk of surgical complications. It's in the low digits, but it's still possible to have bleeding, infection, and some organ damage. Let's look at the numbers. Well, hysterectomy is the most common operation performed probably in the United States. Probably 600,000 hysterectomies are performed, and 73% of all women that have fibroids receive a hysterectomy, which I don't understand that. But because of the recovery time versus a week with UFE, I mean, it's a no-brainer. So most hysterectomies that are performed for fibroids are benign. Studies show a equivalent long-term relief between hysterectomy and UFE, which is uterine fibroid embolization. The critical difference is the invasiveness and the recovery time and the uterine preservation. So before you discuss hysterectomy, ask your doctor, am I a candidate for UFE? Second thing is myomectomy, which is surgical removal while preserving the uterus, where they try to remove the fibroids from the uterus. This can be done with a big incision. It can be done laparoscopically too, or through a hysteroscopy through the cervix. Here, the uterus is preserved, fertility is maintained, it removes fibroids directly, and it's good for large intramuscular fibroids when there's only 1 or 2 and you really want to get pregnant quickly. The cons is that fibroids can come back, usually about 30% chance they come back within 5 years, some within 2 years. General anesthesia is required. Recovery is usually about a month. And there's a risk of scarring the uterus and affecting fertility. And it's not practical if there's a very large amount of fibroids, if you have more than 10, for example. And lastly, but most importantly, uterine fibroid embolization. This is what we do. It's image-guided invasive procedure, but it's done by a vascular surgeon or interventional radiologist that blocks the blood supply to the fibroid and just causes them to shrink. It's done through an IV in the wrist, and it takes about an hour, and you're home the same day. It's done with local or moderate sedation. It's 1 week recovery. The fibroids decrease, involutes completely, and there's great patient satisfaction from it. Like I said, it's done by a procedural specialist, interventional specialist, and it's pretty much very tolerable. So, but the problem is a 3.5% problem. Only 3.5% of women have a UFE. This is essentially just an awareness problem. So most GYNs, they don't perform UFE, so they don't bring it up during consultation. The referral patterns favor the GYNs getting them. UFE, it's been around for about 25 years. It's just an awareness issue. And most physicians incorrectly believe that UFE can affect fertility. But, up to 62% of women with fibroids have never heard of UFEs, but that's why we're educating. So these are the three options at a glance, okay? You have all the three options at a glance. You can look at different options here. Obviously, if you're a woman of working age, it's a no-brainer to do a UFE. It is covered by insurance. There's good relief. It has similar attributes long-term that all the other procedures as well. So let's talk about myth versus fact. The myth: hysterectomy is the only real cure for fibroids. That's not true. UFE means you can't have children afterwards. That's not true. Many women have healthy pregnancies after UFE, but if fertility is your top priority, we can discuss the options between myomectomy and UFE with me personally. UFE achieves the same long-term results and symptom relief as removing your uterus. So it's really the same effect. So what's the question every woman would be asking is, am I a candidate for UFE? Because it's minimally invasive. So let's go through the UFE procedure step by step. Like I said, you arrive, you get your consult and imaging. If you're under 40, just do an ultrasound. If you're over 40, usually want you to do an MRI. We prep you. It's done through a tiny puncture, just a tiny IV started in your wrist. Then we put a long spaghetti catheter. It's access. Then the next step is positioning. We position a long spaghetti catheter all the way down your uterine artery under X-ray guidance. And then embolization. We inject tiny beads that are injected that block the blood supply to the fibroids, cut off their blood supply. The procedure is done in 45 minutes, and you rest for about 30 minutes before you go home the same day. Let's look at a brief video that shows everything clear.
This video has been produced to familiarize you with the uterine fibroid embolization procedure, UFE. UFE is a safe, effective treatment for fibroids that has been performed for nearly 20 years. It is one of several treatments that may be used to treat fibroids in the uterus. Uterine fibroids are non-cancerous growths that develop from normal uterine muscle cells. There are 4 types of fibroids that develop in or just outside of the uterus. Submucosal fibroids grow into the uterine cavity. Intramural fibroids grow within the wall of the uterus, and subserosal fibroids develop on the outside of the uterus. Pedunculated uterine fibroids occur when a fibroid tumor grows on a stalk, resulting in pedunculated submucosal or subserosal fibroids. All fibroids require a supply of blood to survive and grow. UFE takes advantage of this fact to target the fibroids. Uterine fibroid embolization is a minimally invasive procedure. UFE does not remove the uterus or the ovaries. A small incision is made in the leg to gain access to the femoral artery. A long flexible tube called a catheter is then inserted into the femoral artery. It is guided up the femoral artery and into the artery that supplies blood to the uterus, called the uterine artery. The catheter is then guided to smaller arteries that supply blood to the fibroids. Uterine fibroid embolization delivers tiny microspheres to the artery that supplies the fibroids, cutting off the blood flow, causing the fibroids to shrink. The tiny microspheres are injected through the catheter and travel through the blood vessel. Since the microspheres are more than 60 times larger than red blood cells, they plug the tiny vessels that red blood cells travel through to feed the fibroid. The procedure is repeated in the uterine artery on the other side to make sure that all blood supply to the fibroids has been cut off. all fibroids are treated simultaneously. Once the blood supply to the fibroids has been blocked, the fibroids begin to shrink. There is no scar tissue and minimal blood loss with UFE. Recurrence of the fibroids with uterine fibroid embolization is rare. Most women are able to return to light activity within a few days of the UFE treatment and are usually back to work and normal activity, on average, within 11 days. Take back your life today. Ask your doctor if uterine fibroid embolization is the right treatment for you.
So let's understand a little bit about microspheres. These are tiny synthetic beads about the size of a grain of sand. They're FDA approved embolic agents and they're designed exactly for this procedure. They've been around for about 25 years, so it's been done in millions of women without any problems. They're injected right into urinary arteries and they block the blood supply. The fibroids then shrink over 3 to 6 months, and a majority of them completely disappear. This is FDA approved, it's not an experiment, it's been done every day. What's your recovery? Well, pretty much the procedure takes 45 minutes. You go home the same day, you're back to life, back to normal activity in about a week. This is usually the timeline. After you go um, back to normal activity, we see you 1 week, 1 month, then 3 and 6 months, and usually we do another repeat scan to show that the fibroids are gone. So, what is the main thing after UFE? What is the main quote unquote complication? It's something called post embolization syndrome. It's pretty much severe pain immediately after the procedure is done because the uterus is a muscle. So, when it's embolized, you have severe pain. We'll put you in a narcotic regimen, a fentanyl patch, a muscle relaxant, and anti inflammatory agents during this period. You do have nausea, some flu like symptoms for 24 to 48 hours. That means the procedure is working because your immune system is responding to the fibroid tissue dying off. Your body breaks down the fibroid and creates a temporary inflammation. So we give you a whole regimen to deal with this post-embolization syndrome. This is not a complication. It's a sign that the procedure has worked. So is UFE painful? The procedure itself is not painful, but it's what happens during the post-embolization syndrome that there is pain. And we give you multiple layers of support for this. Moderate sedation during the procedure, IV pain management and recovery. We prescribe anti-inflammatories at home, anti-nausea medication, give you a fentanyl patch to get you through this post-embolization period. Now let's talk honestly about UFE and fertility. The good news is that your uterus is preserved with a UFE. You keep your uterus. Many women have had successful pregnancy after UFE. UFE is often preferred over myomectomy for women with multiple fibroids, and it avoids any surgical scarring. However, for women not planning, and also for women not planning future pregnancy, UFE is an excellent option if you're done getting pregnant. But important considerations here. UFE is not the first line of treatment for women who want to conceive within 3 to 6 months. And also, some studies show a possible miscarriage risk with UFE compared to myomectomy. If fertility is a primary concern within 3 to 6 months, then we can discuss it. Usually, if you have just one fibroid, you can just get it removed with a myomectomy if you're planning to get pregnant within 3 to 6 months. So, what are the long term results of UFE? You have 83% average shrinkage at 6 months, 90% satisfaction rate, and over 5 years sustained symptom relief. So, pretty much your symptoms go away. Does insurance cover it? Yes, even Medicaid. All insurance covers it. And because we're a high volume of facility, we get the approval right away. We have an authorization team that does all the approvals, so you don't have to worry about anything. So I've answered most of the tough questions about this, and I'm going to take this to questions now. If you have any questions for me, I'm going to open up the mic for questions. Let me mute everyone. to. Anybody have any questions? You can put your questions in the chat. You can type your questions in the chat if you have any questions for me. I'm going to put my email in the chat. If you want to send me an email, I can call you after this webinar and we can discuss your treatment options. I put my email in the chat. You can send me an email with your phone number. I can call you right after so that we can have a private conversation. So grab my email in the chat. We can discuss this, have a private conversation with you after we're done. So we have 5 locations to serve you in Florida. If you're interested in getting this procedure done, that's our phone number on the screen. You can just call or text us. We'll respond immediately to you. And this is your path to treatment. It's very straightforward. So just book a call right now or send me an email and we can just speak right after this this talk. Okay, if there are no questions, send me an email. I'll call you right after this. If there's no specific questions, let me make sure nobody wants to say anything. Trying to mute. Type any questions in the chat. If there are no questions, I want to thank you for coming, and we'll pretty much end the webinar here. Have a good evening.